የዓለም ኤድስ ቀን ለማክበር እዚህ የተገኛችሁ በመጀመሪያ በዚህ በህዳር 21 በየዓመቱ የምናከብረው በዓለም አቀፍ ደረጃ ለ36ኛ ጊዜ የሚከበረው የዓለም ኤድስ ቀን ላይ እዚህ ስለተገኛችሁ በራሴና በጤና ሚኒስቴር ስም እንኳን ደህና መጣችሁ ለማለት እወዳለሁ። ወልካም። I would like to my official statement on the remarks should be in Amharic, but to acknowledge the presence of our partners, I'm going to just say a few words first. As this year, as we celebrate World AIDS Day with the theme of Let Communities Lead, we are trying to, as mentioned, remember the contributions of communities and the leadership of communities in the progress we have made in the HIV's prevention and control globally and in our country. And also remember those lives who have been lost also through the pandemic, but also to commit to create conducive environments for communities to play strong leadership role to achieve the remaining goals that we have, and also to call upon communities to play this strong leadership role to meet the needs in terms of the gaps that we still have to eliminate this the HIV/AIDS pandemic epidemic. As we know, Ethiopia has had significant progress and strides in terms of reducing the incidence and reducing the mortality from HIV/AIDS, and this was possible because of the strong political and government commitment, but combined with our strong partnership with diverse partners, many of you represented in this room, from the support of the US government, of HEPFAR, UNAIDS, and all UN agencies, UNDP, WHO, and many others, the Global Fund, and also our local partners and stakeholders and implementing partners, civil society, but also communities themselves, working hand in hand, and we have reached this milestone. But it's also a critical moment that we have to acknowledge we still have a long way to go in terms of the ambitious commitment that we have in terms of the elimination of HIV/AIDS. And I think the areas that require our attention and our collective efforts have been well outlined in the presentation by Ricardo. And again, acknowledging and appreciating all the solidarity and strong partnership we've had to achieve this milestone. I again call upon all our partners again collectively work on these key gap areas that we have that has been outlined. And I will not go into much details in them, but there are still large number of HIV positive patients who have not yet known their status, which requires strong effort in many innovative interventions in achieving the first 95. We are still at 84%. In terms of ensuring strong community engagement and innovative interventions in this regard, there are many initiatives that have been started, which are linked to our strong community health extension program that complemented by the work that we are doing with diverse partners in the society, like the community health monitoring that was mentioned, not only in terms of the detection, but in ensuring that patients who have been identified adhere to their treatment, but also ensure that we are providing a holistic and integrated care and treatment for all our patients, not only for HIV, but holistically for other diseases like non-communicable diseases, to ensure the health and well-being of our communities. The challenge of addressing the maternal to child transmission of HIV and pediatric HIV is also a big priority that requires our attention, but also the restoration of services and ensuring that our patients who have been disrupted or affected by the different displacements, conflicts, and other challenges are also ensure the restoration of treatment and care and treatment for these communities is also the other key area that requires attention. In addition, we still have the challenge of stigma and discrimination for our communities, which was called upon by the class director earlier on, as well as the strong attention we need in terms of diabetes finding and prevention for our key and priority population. If we collectively work on this with the strong engagement again of communities, when you say communities, it also includes religious leaders, the media itself, and all up to the grassroots level, including our civil society, we will definitely collectively achieve the goal that we have envisioned. So thank you once again for your strong uh, commitment, continued sustained support, which will enable us to sustain the epidemic control and reach the goal that we have collectively outlined. So I'll now go back to my official address in our የዘንድሮ የዓለም ኤድስ ቀን የማህበረሰብ መልእክት ለላቀ ኤች አይ ቪ መከላከል በሚል መሪ ቃል እየታሰበ ሲሆን ይህን ስንል ማህበረሰቡ ኤች አይ ቪ በመከላከል ረገድ ላበረከተው ጉልህ አስተዋጽኦና ለተጫወተው የማይተካ ሚና በሀገር አቀፍ ደረጃና በየደረጃ ውስጥ ባለው የመንግስት መዋቅር እንዲሁም በማህበረሰብ አደረጃጀት ለዚህ አስተዋጽኦ እውቅና እንሰጥበት፣ እንደዚሁም በቀጣይ ማህበረሰቡ የመሪነት ሚናውን እንዲወጣ ምቹ ሁኔታዎችን ለመፍጠር ቃል የምንገባበትና ማህበረሰቡን በኤች አይ ቪ መከላከልና መቆጣጠር ስራችን ላይ ሚናውን ይበልጥ እንዲያሳድግ ቁርጠኝነትን እንዲጨምር ጥሪያችንን በማድረግ የሚያድስበትን ቀን ነው። የኤች አይ ቪ ስርጭት ከፍተኛ ከነበረበት አሁን ወዳለበት ወደ 0.1% ለመቀነስ ማህበረሰቡና መንግስት ከበርካታ ባለድርሻ አካላት ጋር ያበረከቱ አስተዋጽኦ ከፍተኛ ስለሆነ ይህ የዓለም ኤድስ ቀን የሚከበረው ይህንን መሪነት ለማጉላትና ለቀጣይ ስራችንን ይበልጥ ለማጠናከር ነው። ይሁን እንጂ ኤች አይ ቪ ኤድስ ዛሬ እንዲሁም በማህበረሰባችን ላይ የጤና፣ የልማት፣ የማህበራዊ እና ኢኮኖሚያዊ ችግሮችን እያስከተለ የሚገኝ ነው። በጤና አስታውሰው በ1990ዎቹ መጀመሪያ ባሉት በነበሩት ዓመታት የኤች አይ ቪ ስርጭት ምጣኔ በከፍተኛ ደረጃ ጨምሮ የነበረ ሲሆን በተደረጉ መንግስታዊና መንግስታዊ ያልሆኑ ድርጅቶችን፣ ሲቪክ ማህበራትን፣ ዓለም አቀፍ ለጋሽ ድርጅቶችን፣ የሃይማኖት ተቋማት፣ የግል ዘርፍ እንዲሁም ማህበረሰቡ ባደረገው ጥረትና ትብብር የኤች አይ ቪ ኤድስ የጸረ ኤች አይ ቪ ኤድስ አገልግሎቶች ሁሉ አቀፍ ተደራሽነትና ሽፋን ከጊዜ ወደ ጊዜ እንዲጨምር በማድረግ የቫይረሱ ስርጭት በከፍተኛ ሁኔታ ለመቀነስና ሊያስከትል ይችል የነበረውን የከፋ ችግር ለመቀነስ ተችሏል። ሀገራችን በ2030 የማህበረሰቡ የጤና ችግር ኤች አይ ቪ ኤድስ የማህበረሰቡ የጤና ችግር ወደማይሆንበት ደረጃ ማድረስ የሚለው ራዕይ ከግብ ለማድረስ የተለያዩ ግቦችንና ስራዎችን አስቀምጣ በመተግበር ላይ ትገኛለች። ከነዚህም በዋናነት የሚጠቀሰው በ2025 395 ማሳካት ነው። እነዚህን ግቦች ለማሳካት መንግስት ጉዳዩ ከሚመለከታቸው በርካታ አካላት ጋር በህብረትና በቅንጅት በመስራት ዘርፈ ብዙ እንቅስቃሴዎችን በማድረግ ብዙ ውጤቶች እየተመዘገቡ ይገኛሉ። በዚህም መሰረት በ2022 ቅድም እንደቀረበው በኤች አይ ቪ ስፔክትረም ውጤት መሰረት ኤች አይ ቪ ኤድስ በደማቸው ይገኛል ተብሎ ከሚገመቱ ወገኖች መካከል 84% ራሳቸውን የሚያውቁ ሲሆን ከነዚህ ደግሞ 98% ያሉ የጸረ ኤች አይ ቪ መድኃኒት እንዲጠቀሙ ማድረግ እና መድኃኒት ከሚወስዱት ውስጥ ደግሞ 96.3% ያሉ የቫይረስ ኢንፌክት መጠናቸው በሚፈለገው መጠን እንዲወርድ ማድረግ ተችሏል። በተጨማሪም በአንድ ዓመት ውስጥ በኤድስ ምክንያት የሚከሰት የሞት መጠንን በ2010 ከነበረበት በ52% መቀነስ ተችሏል። እናቶች የቅድመ ወሊድና የድህረ ወሊድ አገልግሎት እንዲያገኙና በተቋም እንዲሆኑ በማድረግ ኤች አይ ቪ ከእናት ወደ ልጅ የመተላለፍ ምጣኔው እንደ አውሮፓ አቆጣጠር በ2010 ከነበረበት 46% ወደ በ2022 ወደ 12% መቀነስ ተችሏል። ክቡራትና ክቡራን፣ እነዚህ ከላይ ያነሷቸው ውጤቶች ለፈውሱ በሆነ ተቋማዊና ድርጅታዊ አሰራር የተገኙ ሲሆን እነዚህ ውጤቶች ለማስቀጠልና አሁን የማይቀሩንን ብዙ ክፍተቶች ለመምላት ኤስ